Good evening. This is All India Radio, Kohima. I'm Jonas Yantan with the evening news. The headlines. Prime Minister Narendra Modi says country's endeavour is to ensure that the benefits of space program reach out to the poorest. NITI Aayog releases white paper Vision 2035 Public Health Surveillance in India. Central team visits Nagaland to assist State Health Department on public health measures and clinical management for COVID-19. And Nagaland's COVID-19 tally reaches 11,728. Prime Minister Narendra Modi today said the country's endeavour is to ensure that the benefits of the space program reach out to the poorest, interacting with key industries, startups and academia from the space sector via video conferencing to encourage their participation in space activities. Modi expressed hope that the country would soon become the manufacturing hub of space assets. He said reforms in the space sector are not limited to ensuring ease of doing business, but also help being provided at each and every stage. Prime Minister Modi noted that the professionalism and transparency in policies as well as the decision-making process of the government will prove beneficial for the companies joining the space sector. NITI Aayog today released a white paper Vision 2035 Public Health Surveillance in India. The white paper lays out India's vision for public health surveillance through integration of three-tiered public health system into Ayushman Bharat. It also spells out the need for expanded referral networks and enhanced laboratory capacity. The building blocks for this vision are an interdependent federated system of governance between the centre and the states. The white paper was released by NITI Aayog Vice Chairman Dr. Rajiv Kumar, Member Health Dr. Vinod K. Paul and CEO Amitabh Kant. The vision of this white paper is to make India's public health surveillance system more responsive and predictive to enhance preparedness for action at all levels. Citizen-friendly public health surveillance system will ensure individual privacy and confidentiality enabled with a client feedback mechanism. A three-member central team from the Ministry of Health and Family Welfare, Public Health Division, visited Naga Hospital Authority Kohima, NHAK, today to assist the State Health Department in review of public health measures and clinical management for COVID-19. The team included Additional Secretary and Financial Advisor, Ministry of Road Transport and Highways, Nodal Officer Sanjay Kumar, Senior Public Health Kolkata, Dr. S.R. Karmakar, and Associate Professor Medicine, Northeast Indira Gandhi Institute of Health and Medical Sciences, Dr. Mohammad Jamil. The team reviewed overall COVID-related activities in regard to containment, surveillance, testing, infection prevention and control measures, and clinical management protocol for COVID-19 in the district. Managing Director Dr. Torhuse Katiri briefed the visiting team on the status of COVID activities at NHAK. He informed that NHAK has collected a total sample of 24,806, which included 17,308 from BSL-3 and 7,498 from TrueNat as on 13th of December. Out of 24,806 samples collected, a total of 2,759 were detected as positive cases, while 21,925 were negative cases, while 122 cases are awaited. Dr. Torhuse also said that positive cases admitted in NHAK were 339, where 263 were discharged, 21 deaths, and 43 were shifted to Merima COVID Care Centre, other hospitals and home isolations. Nagaland's COVID-19 tally reached 11,728 with detection of 19 fresh positive cases today. Health and Family Welfare Minister S. Pangyapom in a tweet said 8 cases were reported from Mukokchung, 6 in Dimapur and 5 from Kohima. Also, 56 patients have recovered from the infection, which included 29 in Kohima and 27 from Dimapur. Of the cases reported today, 18 cases were from traced contacts and 1 from armed forces. Out of 72 deaths registered, 62 died due to COVID. 7 deaths are not COVID-related, while 3 deaths are under investigation. So far, 127 cases have migrated. At present, there are 10,939 recovered cases, while active cases stand at 590. Ministry of Finance has released the 7th weekly installment of 6,000 crore rupees to the states to meet the GST compensation shortfall. Out of these, an amount of 5,516.60 crore rupees has been released to 23 states and an amount of 483.40 crore rupees has been released to 3 union territories with Legislative Assembly, Delhi, Jammu and Kashmir and Puducherry, who are members of the GST Council. The remaining 5 states, Arunachal Pradesh, Manipur, Mizoram, Nagaland and Sikkim, do not have a cap in revenue on account of GST implementation. This news comes to you from All India Radio, Kohima. Defence Minister Rajnath Singh today said that government has taken various steps to effectively deal with the COVID-19 pandemic. He said financial assistances and food security have been provided to the needy people during COVID-19 crisis. Virtually addressing the valedictory session of FICCI annual conclave, Singh said, Atmanirbhar Bharat package, which is worth 20 lakh crore rupees, have provided relief to the poor workers and small industries and helped in mitigating the effects of COVID-19. Allaying the fear of farmers, the minister said there is no question of taking retrograde steps against the agriculture sector. The minister said centre is taking steps in the direction of interest of the farmers and the government is always ready to listen to them. Information and Broadcasting Minister Prakash Javadekar today said that India has handled the coronavirus situation very well. Addressing the International Coronavirus Short Film Festival in New Delhi, Javadekar said that the crisis of COVID-19 pandemic was identified very quickly by the Prime Minister Narendra Modi in January itself, and he countered it with a visionary zeal through the whole year and succeeded in controlling and mitigating the situation. Javadekar said the International Film Festival of India will take place in hybrid mode from 16 to 24th January next year in Goa. Department of Land Resources LRT Kifre today organized culmination program of watershed development component in the Graded Watershed Management Program Pradhan Mantri Krishi Sinchai Yojana Batch 3 Project 4. Speaking at the culmination program, STO Civil James T. Kulu expressed hope that the department will continue to carry on the good work in uplifting the livelihood of the farmers, stating that the government has introduced various schemes and projects under different departments to improve livelihood of the farmers. He, however, lamented that most of the people failed to execute the project on the ground. Deputy Director LRT Ahoshe Sema urged upon the beneficiaries to judiciously make use of the funds in order to improve livelihood and economy. Beneficiaries from 11 villages attended the program. Dimapur police apprehended one person from Walford Colony, Dimapur today and recovered one .32 pistol, country-made with one magazine. In this connection, a case has been registered at East Police Station, Dimapur. An investigation is going on. Dimapur police also apprehended one person on 12th of this month near Newfield Jackgate area, Dimapur, and seized one .22 country-made pistol with one magazine. A case has been registered at East Police Station and further investigation is going on. And as the nation fights COVID-19 pandemic, let us all remember to stay safe and protected by following these 3 simple steps. Wear a face mask, wash hands frequently with soap and water, or use hand sanitizer and follow social distancing norms. And now 20 news, here are the main points again. Prime Minister Narendra Modi says country's endeavour is to ensure that the benefits of space program reach out to the poorest. NITI Aayog releases White Paper Vision 2035 Public Health Surveillance in India. Central team visits Nagaland to assist State Health Department on public health measures and clinical management for COVID-19. And Nagaland's COVID-19 tally reaches to 11,728. That is all we have in this evening news bulletin. Good night.